So Barrett's esophagus is a very common condition that I see in the GI tract. And what this basically is, it's a precancerous lesion of the esophagus from chronic acid reflux. Now the issue when it comes to Barrett's esophagus is that this has a chance, in fact a good chance, of progressing into esophageal cancer. So my role is to see if I can find out exactly what is going on, what type of Barrett's esophagus that you have, but also try to find my patients on the risk factors for developing Barrett's esophagus and esophageal cancer. Now, we can diagnose Barrett's esophagus by doing what's called an upper endoscopy or an EGD. And when I take a look with an EGD, I can see certain cells that are forming on the upper scope that tell me they have Barrett's esophagus. But not only do you have to see that, you actually have to have biopsies from this to see exactly what is going on and tell me, A, do you have Barrett's esophagus? And what type do you have? There's three main types of Barrett's esophagus that I tell my patients. Number one, you have Barrett's esophagus without cancer cells. This is a very low chance, less than 1% chance of developing into esophageal cancer, which means that in most cases, we can just do surveillance. We repeat an EGD in 3 to 5 years. The next type is Barrett's esophagus with a small amount of cancer cells. This is called low-grade dysplasia. In this setting, we have two main options we can do. Number one is that we can still do surveillance, but we do it more sooner or more quickly, or we can do what's called radiofrequency ablation, where I actually burn off part of the esophagus. And our goal with that is to get rid of those precancerous cells and allow normal cells to come back. And the third type of Barrett's esophagus you can have is Barrett's esophagus with high-grade dysplasia, with lots of precancerous cells. And there's no doubt what we need to do with this case. We have to do ablation in that case because there's a high chance of this developing into esophageal cancer. So like I mentioned before, when we take a look with an EGD, I can see exactly what's going on with Barrett's esophagus. And on this EGD, you can see here, you are in the esophagus and you have cells here that are forming. So I did NBI. NBI is a way for us to change the color, and I can see in this color that there are precancerous cells called Barrett's esophagus in this esophagus. You can see this right here. The white are the normal cells in the esophagus called squamous columnar, and the pink are the Barrett's esophagus cells. And you can see right here, this is the transition. So this is a large segment of Barrett's esophagus, and here it is under regular light. The pink is the Barrett's esophagus, and the white is the squamous epithelium that is not Barrett's esophagus.